Hello and welcome everyone. We will get started right at 2 p.m., so hold tight. Hey everyone, we will get started at 2 p.m. So we're just waiting to get started, but welcome and we're looking forward to today's webinar. Hello and welcome everyone. I will go ahead and get started as the clock just struck 2 p.m. Welcome again to the Housing and Services Resource Center webinar on integrated service coordination models for housing providers. Go ahead to the next slide. My name is Katie Clark Wheeler, and I will be your facilitator today. As we get started, I encourage everyone to introduce yourself using your name, your agency, location in the chat to connect with your fellow participants. I know many have already gotten started on this. And just one quick note, some of us on the East Coast are experiencing severe weather today during our webinar. We first hope that everyone is staying safe as they're able, and our team has plans in place to address any issues with the webinar if we experience an outage. So if you notice the webinar shuts down at any point, please just rejoin using the same link you used to enter today's event. But fingers crossed, we will make it through just fine. And go ahead to the next slide. Before we get started, I will share a few notes on housekeeping. For audio, you can use your computer speakers or dial in using the phone number in your registration email. Please note that all participants are muted during today's webinar. We really encourage you all to use the chat to share comments or connect with other participants. We will also have time for questions for our panelists at the end. To ask a question for the Q&A, please use the Q&A function on Zoom, clicking that button on the bottom. And this will allow the presenters to easily find your question and address it. You can also send your questions or comments to us over email at hsrc@acl.hhs.gov. We will have someone monitoring that inbox throughout today's webinar. And one final note that this event is being recorded. So by staying to participate, you are agreeing to participate in the recording. Next slide. We will have ASL interpreters pinned throughout the webinar. To enlarge the view of the interpreter, you can click on their window and select the pin icon to maximize your view. If you are using a screen reader and want to reduce unwanted chatter, you can request speech on demand by hitting the Insert key, spacebar, and the letter S on your keyboard. Next slide. All right, well, wonderful. We will begin today's webinar by discussing the benefits of a cross-sector coordinated approach to service coordination. We will then introduce you to a newly released HSRC Service Coordination Partnerships Toolkit, which includes a section aimed specifically at housing providers. I am then very excited to welcome speakers from the National Church Residences, which is one of the case studies we feature in this new toolkit. Our speakers from the National Church Residences will share about their service coordination model scaled across their buildings in locations across the U.S. We will conclude with questions from the audience. We hope this will be an opportunity for you to dig deeper about this successful model and how you could replicate it. You can share your questions with us through that Q&A feature throughout the webinar for us to gather and use at the end. Next slide. All right, wonderful. Well, again, before I introduce our speakers, I want to first highlight the benefits of service coordination and why we are focusing on this topic for today's webinar. Next slide. Now, there are many definitions across various sectors for service coordination, but for the purposes of this webinar and the HSRC toolkit, service coordination is defined as activities that support individuals in identifying and connecting with services and supports they need and want in the community. Now, at the very least, service coordination should include learning about a person's needs and preferences for support, helping individuals gain access to the people, organizations, and programs that meet their needs, working together with that individual to document their goals, their strengths, needs, and preferences, and then identify what supports are available to meet those needs that fit with their goals and preferences. Remember, through this process, we are working towards that person-centered plan. This also includes assisting with program applications and enrollment processes for the services chosen, and then finally following up to ensure that those services and supports that were selected are being accessed and also meeting the individual's needs, and that you're also able to provide adjustments to the plan as needed. Next slide. Now, service coordination allows older adults and people with disabilities the opportunity to age in place, live safely and successfully in their community housing of their choice. Studies have shown that without service coordination, many older adults and people with disabilities do not access or enroll in the community-based services for which they qualify that may enhance their safety and independence in the community. Service coordination increases housing stability for older adults and people with disabilities by preventing the unnecessary vacancies due to hospitalizations and facility placement, helping connect individuals to right-size community assistance. For example, housekeeping concerns that may threaten their community placement, allowing service providers to intervene and help prevent a crisis that might threaten their housing placement, and increasing safety as new needs and services or supports are identified and then put in place. Service coordination has also shown improvements in the health and quality of life for older adults and people with disabilities in the community. Service coordinators can help identify food insecurity issues early and address them with community supports, assist in coordinating care in order to manage chronic conditions, and working with those community partners in order to bring wellness programs on site that provide direct health benefits. And finally, often overlooked but increasingly important benefit to coordinated service coordination is reducing isolation. For older adults and people with disabilities, social isolation can create very strong negative health and wellness impacts. On-site staff included in the service coordination process provides an opportunity for social interactions and community engagement by bringing programming directly to the individuals in the subsidized housing. Stronger social relationships and social connectedness are also associated with healthy aging and aging in place. Next slide. So at a high level, some identified key strategies to successful service coordination include really emphasizing person-centered planning. The plan developed must meet the individual's needs, their goals, and preferences. Also, building trusting relationships with the individual and the community housing allows for early identification of any additional needs. Coordinate with the housing team, such as the property manager and the maintenance lead. These coordinated efforts are more effective as each person brings their own unique perspective in addition to their various programs and services they may be involved with. Invest in a service coordination workforce. Successful service coordinators are well trained in person-centered planning and have continued support and training on resources available and how to make those adjustments to fit newly identified needs. Focus on prevention and whole person health. Prevention is the key to proper self-management of chronic conditions. Addressing whole person health allows for a comprehensive response to community support needs, increasing the likelihood of success. And finally, develop and maintain those partnerships with as many community organizations as possible. Remember to think across all sectors: aging, disability, health, and housing. A coordinated approach increases chances of success in the community. Next slide. Now, to create those strong and sustainable cross-sector collaborations, we have a few things we recommend that you keep in mind. Again, develop that extensive community partners list. Consider partners like food banks, aging and disability resource centers, benefit enrollment centers, healthcare providers, assistive technology programs, disability network organizations like SILS, and state independent living councils, other aging network organizations like area agencies on aging and state units on aging, and even transportation. And then really leverage those partnerships to bring programs and services on site. This could include nutrition assistance, chronic disease management programs, social engagement, technology use classes, and transportation services. Next slide. Now, for many housing providers, a big question to consider is often, how do we fund this coordinated approach and service coordination? Grants under the U.S. Department of Housing and Urban Development Service Coordinator in Multifamily Program might still be available. So we encourage you to explore whether your agency qualifies for these grants and how to apply for them. Other sources of funding that we know many of our partners used is operating budgets, health plan contracts, philanthropic support, state and local programs, also to build, support, sustain, and expand that service coordination. Next slide. All right, well, we hope you all, at the conclusion of this webinar, will be eager to get started. In terms of some next steps, we recommend first reviewing our new Service Coordination Partnerships Toolkit on the HSRC website to learn how other housing providers are approaching this. The toolkit includes 4 case studies and an overview of successful strategies for these model programs. We encourage you to read each one and ask, can we adapt or replicate part of this model in our own service coordination partnership? We know there is not one way that works across all organizations, so we invite each state and community to work with the partners and resources you have available and find a model that works for you. Next, we encourage you to start connecting with those possible partners. Reaching out to your state and local aging networks, AAAs, and state units on aging are a great place to start. Also consider your disability network. Maybe begin connecting with your Center for Independent Living or a statewide independent living council. Aging and disability resource centers are also available in states and localities. And of course, don't forget that the health system partners can be a valuable asset as well. Local and state hospitals, health plans, behavioral health units, and agencies can all provide a valuable connection to the communities and individuals you serve. And so as you connect with each potential partner, ask questions and take notes on how best to determine your strategy in moving forward. Explore all and any opportunities to collaborate and how you both can work towards increased access to service coordination. Strategize on funding mechanisms that you both can use and leverage to fund this model. And maybe even consider an initial pilot to test out your model and how to do this. Use your pilot to analyze if your model is effective and how best to make adjustments. And once you've developed a model that works, you can work with your partners to scale that into a wider coverage area. Often, the data you collect in your pilot program will help you gain support and maybe even additional funding to scale and sustain this work. Next slide. Okay. Well, now, before we hear from our featured presenters, I want you all to take a look at our new resource that I've mentioned a few times, this Service Coordination Partnership Toolkit. You can find this web-based tool on our website, and we will drop the link in the chat so you can access this on your own. Next slide. This toolkit was designed to help housing partners, health and healthcare entities, and also the aging and disability network providers and leaders to build cross-sector partnerships to support service coordination, identify possible funding and potential partners to include in your model, discover some promising practices from other providers to sustain and expand service coordination activities, and access additional tools and TA resources to get started, or to keep you moving through the process of designing, implementing, and scaling. So very quickly, let's take a look at the 4 case studies included in the toolkit's housing section. We can go ahead to the next slide. So on the screen, there is a table that provides information on the 4 case studies that we included in this housing section of the toolkit. You can see that we interviewed housing providers and service partners from 4 different locations with a varied number of sites under their program service area, serving anywhere from 225 older adults to over 35,000 through the National Church Residences. So we are so excited to have the National Church Residences staff here today. They have also brought along one of their community partners from Ohio. So together they will discuss their service coordination model and some of the lessons learned and best practices they developed as they piloted this program and scaled it to additional sites. So it is now my pleasure to introduce, we can go ahead to the next slide, Jerry O'Rourke, Wendy Foraker, and Evan Garber. I'm going to let them formally introduce themselves as we go through the next portion of this webinar. And again, please remember to place your questions in the Q&A box as we go along. So I will turn it over to our guest speakers. Thank you.
Thanks, Katie. This is Jerry O'Rourke. I'm the Regional Director for Population Health Initiatives with National Church Residences. My colleague, Wendy Foraker, I'll let her introduce herself, and then we'll get started, and we'll introduce Evan, and then we'll get started. Wendy, do you want to introduce yourself?
Sure. Thanks, Jerry. As Jerry said, my name is Wendy Foraker. I'm a program manager with National Church Residences, and I oversee our third-party service coordination role. Go ahead, Evan.
Hi, everyone. My name is Evan Garber. I'm a program manager with Goodwill Columbus. I oversee all of our vocational rehabilitation programs as well as all of our digital equity programs.
Yeah, thanks. So we're going to go and get started. Feel free, next slide, please. We did have a typo on that one slide. We're actually in 34 different states, which is a typo we just didn't catch before this went live today. But next slide. National Church is actually really pretty large. Actually, this is our portfolio of 24 states that are National Church Residences owned or operated programs, including some service coordinator programs. You can see that we have about 25,000 different units. We are scattered heavily on the East Coast, but this just gives you a quick visual of where we are for National Church owned and operated programs. Go ahead to the next slide. This next slide, actually, you can see if we could overlap that, you can see how we get to that 34 states. We are in 28 states for our third-party contracts, which means we operate, and this is something Wendy oversees and operates the day-to-day business. We contract with 130 different service coordinators or their owners and operators where we are not the owner of the property, but we are the expert service coordination in these sites, and they've contracted with us to provide that programming as well as some quality assurance for the eyes and ears of HUD. So this just gives you how we get to 34 states. But in total, that's where we get over 35,000 seniors or adults with disabilities that we are caring for and helping them thrive and age in place. So next slide, it just gives you a little idea of kind of where we're coming from. Yep, there we go. We have, for over 30 years, we've been operating different service coordination programs in our affordable sites. We are a CORS accredited agency, where it means we're certified under Stewards of Affordable Housing for the Future, SAFE. They have, in 2018, they established a credentialing or certification. And so we are a certified entity, which means it is the framework for how we work with service coordinators. It's a template, if you would, to understand a little bit more about how service coordination functions across the portfolios, what data we collect, how we collect it. But as Katie was talking about that whole person health, that is really replacing this language of social determinants of health as we are so used to hearing. We're actually seeing the industry change to whole person health, which is really the same. Right? So CORS allows us to really demonstrate that and be able to look at every individual senior as their own unique person, which is what we've done for over 30 years. So this is a little bit more of our data. My team loves to hear me say, data tells the story. Without the data, we can't tell what we're able to show and demonstrate. But at the core, our service coordinators work with all of our area agency on aging across these 34 states. Oftentimes, the service coordinator's first call should be that area agency on aging to understand what local resources there are in that area that they're able to bring into that building or in the community that really helps to drive our numbers to help ensure that that senior is really aging in place. What that means is they build the resource directories, they're doing assessments, they're really able to demonstrate through that collaboration and that partnership with the local area agency on aging to be able to bring those resources to that area. This is a little bit of the data that we see. We know that 89% of our residents are engaged in the last 12 months. That means one of the service coordinators has completed an assessment. They've been able to engage what programming that individual might want to see, what's important to that senior. And that's all part of the service coordination program that we deliver at our buildings. We also see that we can prevent acute care transitions. What that looks like is 62% are assessed to be low risk, 5% are assessed to be severe. And those are using standardized assessment tools built into our platform when we start asking questions for our residents on what's important to them and how can we help ensure that they're not transitioning to a hospital or a long-term stay. Again, we see social determinants of health. Now we're hearing this whole person health. And we also see the improved wellness and reduced isolation. I love these numbers because when you pull the numbers out of our systems, you really begin to see why partnerships are important and why it is so critical for us to be able to measure what we're doing for that senior to help them age in place. And Wendy is going to talk a little bit about some of our specific programs, such as benefits enrollment that we highlight, as well as digital navigation. And the reason we got into those programs is exactly because we learned through the data that seniors were needing this program. 91% reported high connected, 73% received flu shots because of our partnerships with bringing the flu shots to the building. And then 94% saw a physician in the last 12 months. We know that having our seniors see the physician helps to ensure that they're getting all of their preventative care so that they're not at risk of going to the ER or the hospital to get their primary care. Next slide, please. This is, to me, one of my favorite things. Then Wendy's going to dive into this after. Again, from all the work that we've been working with, I also say that we are also contracted in Ohio. We're one of the providers in a statewide contract with the Department of Medicaid to provide the Money Follows the Person program, which in Ohio we call Home Choice. And with that partnership, we also serve hundreds of seniors and adults with disabilities every year, helping them transition from a nursing facility where they may have been living for years back into an affordable housing site. So there's a great handoff between the work that we do in that program, collaborating with the Area Agency on Aging, and also working with the Centers for Independent Living. And in fact, we contract with 4 of those Centers for Independent Living in Ohio to help us do that work, to hand that off back to a service coordinator in one of our affordable housing sites or any site in the state of Ohio. So I just wanted to call that out before we jumped into digital literacy. I'm now going to hand this over to Wendy because digital literacy is really becoming that critical jumping point of helping seniors go from where they're at now to be able to really help them. If you think about what we encounter, everything that we do is in a portal, right? Your healthcare portal, an application, just even resources that we're trying to get. Well, a senior is struggling with the same thing. If they're not able to understand how to even start their email account, then how are they going to get to a portal? How are they going to pay their rent online, which is what we call Rent Cafe? So I'm going to turn this over to Wendy and then Evan, because they're going to talk about the partnership that really spearheaded this digital literacy as a new super social determinant of health. And this is some of the data that we pulled when we piloted this project. So I'm going to turn it over to Wendy.
Thank you. Next slide. Awesome. Well, as Jerry said, digital is kind of the way of the world as now. We did benefits enrollment as an organization in a pilot group. We now do it with our day-to-day operations. Back in 2019, we were a pilot group that we got funding from National Council on Aging. Since then, we have continued to keep that as part of our model because it has been so successful in the work that we're doing with our seniors. And it is truly mission work for what we do. So we have cross-trained all of our service coordinators across the country for benefits enrollment. And what that is basically public benefits. So making sure that all of our service coordinators have the tools in front of them to see what benefits that their residents would qualify for. So those would be things as SNAP, Medicaid, Medicare savings, utility assistance, prescriptions assistance, things like that. So this was the work we were doing for the last, 5, 6, 7 years. Well, as Jerry alluded to, it does kind of start to turn digital. Everything that we started to do has moved on to digital platforms. If they needed Social Security award letters, we had to go print that off. If they had to submit things for their rent, they had to go get that. If they needed applications completed, they have to either print those off or upload things for that. So everything was moving to variations of different portals. So we were fortunate enough to work with different providers for digital literacy classes. We've done primarily a lot of our work in Ohio, but we have also started to dabble in North Carolina and Michigan. So what this slide here is you'll show is we've been doing this now for over a year. You'll be able to see some of our numbers. Sorry.
I'm happy to take over a little bit while
Evan, go do that.
Yeah, while Wendy's working through some technical things. So, as a provider in partnership with National Church Residences here in Central Ohio, and this is not unlike many other regions across the United States, there's a very concerted effort from social service agencies, other nonprofit partners to work together to meet the needs of what we have in this country called the digital divide, helping people find skills, find devices, and learn how to use them in order to make really significant progress on their own individual goals, whether that be just day-to-day living activities, or that might include upskilling to reach that next job opportunity, or maybe getting that next educational certificate. So National Church Residences and Goodwill Columbus have worked together for many years, but in the past 2025, we had an opportunity to get a grant from the city of Columbus to really collaborate specifically on working with individuals in permanent supportive housing programs. We know that these are some of the most vulnerable individuals, and also individuals that need to be served exactly where they're at. So our team, working together with National Church Residences, was able to provide over 60 different digital literacy workshops right where folks live, right at their housing communities. We had over 500 residents that attended throughout the year, and generally those workshops were roughly about 10 per cohort. So it allowed our facilitators to really give them that one-on-one service that they need to answer all the specific questions that they might have about their device and how to use it. How do I go on and pay my bills online? How do I access telehealth resources? How do I figure out how to use the ever-changing technology and transportation resources that are in our city, whether it's utilizing rideshare services, or how do I maintain the bus schedule that's on an app? And those exist in all cities across the United States, but particularly in high growth urban areas such as Columbus, Ohio. And the individuals that we served at each of the different permanent supportive housing programs, they hit a variety of different populations that we've seen as digital skills being crucial for them to be successful. So individuals in housing need, those who are veterans, those with disabilities, those who are potentially even new Americans, or trying to upskill into the next job opportunity. All those folks were the target populations, and a lot of cross sections that overlapped. So we were really excited. About 85% of the attendees that did this program reported that they had increased confidence after the class, and about 90% said that their workshops met their learning needs. So we're hitting folks where they live. we're scoring massively on getting them the skills that they need to reach those other individual goals. And I think with digital skills comes impact in across all those social determinants of health. It's a rising tide lifting all ships. And to get funded by the city and for our city and community to see that value to working together, it makes me feel good with our team and being able to work together with another strong partner in our community such as NCR. You can probably go to the next slide.
Yeah, Wendy, did you want to say anything about this slide? Unfortunately, Wendy lost power, must be due to the storms that are coming through. But so thanks for jumping right in there, Evan. Again, great partnership, right? That's what you do. You have a lot of conversations with folks, and we can finish each other's sentences. So Wendy, was there anything else you want to call out on this slide, and then we'll switch to Evan?
No, thanks, Evan, for jumping in. Yeah, I apologize for my power turning off and turning back on. But no, it goes to show, you can see when we started this program, where their confidence level was into where it is today after graduating their training with us. So you can go into the next slide, please. So this just goes to show what we have learned is that at least most of our seniors are using smartphones. In fact, I think it's about 89% of them are also saying that they would do training with or without devices. We were fortunate enough with our partnership with Smart Columbus that when they did our digital training class, they did receive a device. That's not always the case in other areas where we've done digital work, but in this footprint that we're talking about, they did receive that. So that's great. 80% of those folks are using smartphones like we talked about. And out of all of that, they would say 87%, the reason that they are using technology is for socialization. So next slide, please. Next slide, please. Yep. So that's kind of like that's kind of what I had said. I'm sorry, already on the previous one, but you'll see that is, yep. Thank you. You're good. You're good. We kind of already talked about that. And so Evan jumped in to save the day. I appreciate that. But we've had a great partnership with him. We have been together in the Smart Columbus grant. So we have focused on digital with a lot of our senior population. And Evan has then did a lot of our permanent supportive housing. And so we've been able to partner with them for various other digital opportunities across the community.
So some of you may be asking, how do I get funding for this sort of work? In our city and in our county, there's been some really gracious effort from our leaders to recognize that digital divide and what kind of resources need to be poured into that. Some of us in our Connect Us coalition, which is our digital equity coalition here in Franklin County and Central Ohio, receive grant funding from a variety of sources, some federal, from NTIA, some of it we get it from private foundations here in the city. The city invests heavily into technology as well as the county commissioners. And then sometimes you can have partnership grants that are from other private opportunities to be able to deliver all the services that you need. So really a recommendation to make sure you stay connected with your partners. If you do not have a digital equity coalition group in your general service area, check with your state. Most of the states have some kind of digital equity plan or digital skills plan. It's required by each state to be able to get federal funding. And many providers who do residential housing programs, as well as serving those with disabilities or needing vocational needs, have recognized that this is a really fantastic opportunity to diversify your portfolio of services to overall serve the individuals that are in your care.
Thanks, Evan. Thanks, Wendy. I think that wraps our portion of what we were talking about. I'm hoping you were able to see that really it starts with a conversation. It starts with common goals, common ideas. If you don't ask, you can't get any answer. So begin to tell that story and come together. And many times, Wendy knows this from hearing from me say many times, wouldn't it be great? Wouldn't it be great if? And then that often starts with, then we're able to build it. And I think that's Evan's partnership with us is a perfect example of that. Many of our pilots start out with a similar conversation, beginning to show the data. We have a great partnership now with several health plans who are partnering with us to help fund service coordination and different programming. And it's called the Berwyn's East. It's a building that we just launched, and this is becoming another new pilot that's a scalable affordable housing, partnering with permanent supportive housing, digital navigation, health activities, health and wellness, as well as other programming that we're going to be able to help bring to the property. But that's possible because we started talking to some of the health plans who had some other common interests. So don't ever hesitate to start that conversation. The funds are out there, you just got to find it. So I think that concludes ours. So I think we're moving into now back to Katie.
Yeah, thank you so much, Jerry, Wendy, and Evan.
Yeah.
And I think your ability to navigate the weather we're all having really demonstrates the strong partnership that you all have. So very impressive, and kudos for tag teaming. And that was a lot of great information. I see we have some questions, so I think we've pulled down the slides and now looking forward to starting the Q&A. So feel free to continue to ask questions, but want to first start with this one question. Would you all be able to specify exactly what types of housing you all work on or this work applies to? Is it just Section 8 housing, or is it broader than that?
Yeah, I could start taking that and then Evan jump in on kind of what your buildings are. But certainly HUD has been a funder for 60 years. So we certainly depend on that. But we also have a lot of, and HUD comes in forms of HUD budgets as well as grants. So some of it are operating budgets. But we also have a fair share of LIHTC buildings. Under National Church Residences leadership, we have a lot of acquisition and development division that looks at different types of funding opportunities. So although I'm not the expert in all of that, we are starting to see and always thinking about what other funds can we access to help build service coordination. We're looking at different models that will allow us to branch into more virtual service coordination. We're all very well aware that the aging population continues to grow. The workforce does not. And so we have to become smarter with how we deliver results for seniors and adults with disabilities, because the people may not be there, but the technology will be. And so that's a little bit of what we're trying to do now. Our partnership with Evan demonstrates that. So kind of my long-winded answer is there are other funding opportunities. You have to find them, and we're continuously looking for that.
Most of the housing
Thank you.
for
Go
for
ahead,
us
Evan.
on Goodwill side, most of the housing that we do is specifically for those with developmental disabilities. So in the state of Ohio, there's a few different pathways for housing, but what we do isn't specific to that. We're very much serving all.
Yeah, that's great. I think we had also gotten a question on if this work applies to persons with disabilities. And to kind of go off, this question of funding, which I know is always something we need to be thinking about in this work. Are any of you securing funds from managed care to support the delivery of programs addressing social isolation?
Yeah, we are. I'll just jump in here, Nevin, if you do, or Wendy. It's a little bit of what I highlighted before with some of the managed care plans that came together in a partnership that we've worked on for at least 3 years development teams worked on it longer, building this model of funds that can help support an entire building. So these 3 health plans actually came together with some funds. It's about $70,000 in total this year, for the ability to fund programming, such as we're going to be launching exercise as medicine, which we also got a shared grant to help fund, nutrition as medicine, different activities that'll help with community engagement to actually measure before and after, like baseline before, how does the senior or the resident feel connected? After all this program, does that change? And we've done different pilots over the year. Funding is always helpful. So these health plans have really believed in our partnership with them. So I'm really excited. That just started. So I'm really excited to see where that goes from here.
Regarding social isolation, so I mentioned before that there's over 100 different partner agencies in our Franklin County Columbus Coalition, which is our Connectus Coalition. So though we at Goodwill don't specifically focus on anything around social isolation, though we know that increasing connectivity helps address that. There are some of our partners who do get funding to address social isolation, specifically around the use of AI tools to help with connectivity for individuals who may be, by housing standards, may be isolated.
Wonderful, thank you. And then I'm curious too, in terms of partnership, we got a question from Audrey Balcom. Have any of you partnered with PACE operators? And for those who aren't aware, that's Program of All Inclusive Care for the Elderly. Or maybe do you operate a PACE program yourself?
Yeah, great question. Wendy, do you want to take this? You've done a lot of work with the PACE programs.
Yeah, I know we actually have a great relationship with our PACE. It's probably like 15 minutes from the corporate office. They actually just came and did a big presentation for our team, so it was nice. But yes, we're working with them for various things. We are referring to them, obviously for folks that are, Medicaid eligible, and therefore that can get their medical, their mental health, all of their stuff in one place. They've been also letting us come and do digital classes for their folks. And we've also been working with some of their team to make sure that they are getting all of their benefits. Their team, obviously, their social workers are able to go through and to do all of their coordinating with different applications and whatnot. But they were backlogged right when they started to kick off. And they're like, we need some help. So we actually set up one day and help them knock out applications as well for Medicaid, SNAP, and so forth. So they have been a great partner with us. And the lady who did speak to us a couple weeks ago did say they're going to be expanding throughout our state. So we're really excited for some of our folks in Dayton and Cincinnati and Cleveland to be able to have those opportunities as well.
Awesome. And I'm curious too, and we're talking about social connection, wellness programs offered on site. Do any of you have experience offering chronic disease self-management programs, which is a suite of evidence-based programs focused on helping people manage their chronic conditions in like a shared group setting?
Yeah, I'll jump in and start the conversation. But yeah, again, our service coordinators are really encouraged to start with your area agency on aging. And when that happens, they start understanding which programs are offered. Every AAA is different, every funding source is different. But I see a lot of service coordinators who share a lot of success stories about classes that just completed their chronic health conditions class or chronic disease class. And they were holding their certificate and really celebrating that they completed that. And I think it's really exciting that we're able to share those resources. So we've done that a lot. Wendy, I think you have a lot of examples of that, and Evan, I'm sure you do as well.
I would say half of our service coordinators have hosted a class in their building in the last year or two. And the other ones that haven't yet are in the process of working with somebody to come in and do that.
Mm-hmm. And that's at no cost to the building. So that's the other great perk. These service coordinators are the masters of working with no budget, right? You go to your service coordinator and they know who to call, when to call them, when you can get free food for an event that they have coming up. They're really good at that. And I think that's what Wendy's referring to as, look how many are already doing that. And that's seamless. I'm sorry, Evan, if you were going to say something.
I was gonna say, yeah, when it comes to special, unique populations related to health, we typically each within the digital equity world, many of us are specialists in certain areas, and then if we're not specialists, we look to work with partners who are. That's why it's so crucial to have a vibrant digital skills community, so you can use each other's strengths together. I know that we have developed, in addition to our partnership with National Church Residences, we've partnered with quite a few individuals who are in drug and alcohol recovery programs that getting access to digital skills, and it goes along right with their housing access, is crucial for getting them off their, getting them on their feet and helping them make progress to the next goal. So if you're not currently doing, we don't do any specific with chronic health uh, issue issues, but we have partners that do, and we allow those open conversations to say, okay, where can we come in and provide this service to meet your folks the best way that we can.
Yeah, that's awesome. And we have another question on from Judy in the chat. I think it's a good one. We've been talking about service coordinators, staff that have that official role. Is there any certification needed for service coordinators, especially ones that are working with maybe really vulnerable populations in housing, or very low income individuals?
Yeah, that's a great question. Wendy, do you want to take that? I mean, day-to-day operations, you know that like the back of your hand.
Yeah. Honestly, what we follow is the HUD regulations. To be honest with you, there is no certificate per se. HUD's requirement is they prefer a college degree. However, if not, they do expect 2 to 3 years experience at the minimum. We have found though most of our service coordinators do have advanced training. A lot of our folks do have bachelor degrees, and I would say about 30 to 35% do have master's degrees. So I would say we have advanced skills to some. I personally know at National Church, we do have a higher standard than some. When we are working in third party, some of their hiring might be a little bit less than what we would look for. But if you want to say off the bat, what HUD requires is somebody that wants to work with this population, that has experience working with seniors. But you'll find most people in this field do have some sort of degree anymore.
There are certification programs as the area or the Service Coordination Association does have a certification program that you could go through. It's not required. We do look, because HUD does require continuing education, which I think really does allow us to help service coordinators identify meaningful education. For example, last summer we kicked off the mental health first aid certification program, which is a 3-year certification. So far we've had 40% of our service coordinators take that, and I haven't heard any negative comments. They have all felt that this has been extremely helpful. They're grateful they took that, and they really are able to use the skills and strategies that they learned in the class right back at the site. And that was a virtual, for the most part, it was virtual. So we look for those types of certification programs to offer, but we don't require it outside of what Wendy already said.
Yeah, that's very helpful. We have about 5 minutes left for questions, and I'm curious, I want to hear from all of you. What are some examples of the impact of service coordination initiatives that you all are implementing? Maybe it's a story of a resident that you've seen really thrive and have better well-being, or system level impact. I know you all shared some data that was very compelling in your slides, but want to give you all the chance to kind of reflect on really the value of this work.
I don't have enough time in 5 minutes to say all that I want to. I'll have Evan and Wendy go first, and I can fill any space we need to, because yeah.
Well, I mean, telling impactful stories is crucial as a service provider. I would say, to stay in generalities, let's look at these little wins that can be found when you get an opportunity to provide a workshop around digital skills. So I vividly remember hearing about a story that Mindy, one of our facilitators, shared about how she was working with this 70-year-old man who had never done a FaceTime in his life, and his granddaughter lives 3 states away, and just by him learning how to do a video chat, something like we're doing right now, which is it's so common for us who have those digital skills to take that for granted. But for an older gentleman who doesn't get to see his granddaughter, just being able to get on the phone and do a video chat for 5 or 10 minutes whenever he'd like, that is life-changing thing. That is a life-changing experience to be able to see and talk with a loved one when you didn't think you had the skills before. Can't even imagine, like, well, I'm sure those in this call can imagine, like, what kind of happiness that brings for someone, what kind of connectedness that brings for someone, and how's that going to impact their overall health. That's just one simple example of how adding a simple new skill will change someone's life.
Well said. Wendy, do you have any?
I just think about some of the work that, like, for instance, something as simple as one of our service coordinators working with one of her politicians to come in and do a food market from her building once a week, where her residents can come in and get fresh fruit, fresh produce at no cost to them, right in their own community room. That's great partnership on her behalf, and that this is something that their residents can all be part of and not have to leave their facility. So that's one example of one that just happened last week with our team.
Yeah, and if I have 1 minute, I can say that this stuff happens all the time. And I love when I have an opportunity, when our leadership or our board is asking for food stamp shortage, when we had the SNAP issue in the fall. It was really impactful when we were all freaking out, right? We were freaking out. We were like, how are we going to help everyone? And I called a few service coordinators and they're like, we got this. We've already been talking about this. We talk about it all the time. Keep shelf stable storage available. Don't ever give your food away. You might need it. And they already have their networks going of who they can help ensure that we're still bringing food to the buildings. So there was not a food insecurity during during that government shutdown and the SNAP issue. To me, that is the one that pops up going, of course they do. Our service coordinators got it all under control and nobody was stressed. And that helps the senior also feel like they're back in control because their service coordinators got their back. So I'll leave it at that because I could talk about many more success stories, but I truly believe in that power of that service coordinator as the really to our future of all the things that we're growing and trying to prove out.
Well, thank you all so much for sharing your time and expertise with us today. It was really valuable. I'm sure we could keep going. There are a lot of really, really excellent questions in the chat. And we will be providing both the slides and the contact information for all of our panelists today. So we encourage you all to continue connecting, asking questions, even after our webinar concludes today. But on that note, I think we can start wrapping up, and I'll ask Juliana to pull up our slides again. Okay, well, again, we've been talking a lot about the Housing and Services Resource Center. Just want to make sure everyone here is aware of our work and all of our efforts that we are putting into building cross-sector partnerships. The Housing and Services Resource Center was launched by the U.S. Departments of Health and Human Services and the Housing and Urban Development in 2021. And we foster cross-sector partnerships between organizations and systems that provide housing resources and homelessness services, healthcare, mental health services, independent living and other supportive services. This is a part of an interagency initiative to streamline and expand access to affordable and accessible housing and the critical services that make community living possible. So we work together at the federal level and really mirror or hope to create those partnerships between us federal agencies that we hope you all are able to do as well, because we know these topics do not exist in silos and people need a range of services and supports to thrive stably in their communities. So we are continuing to update our website regularly. We just added a rural housing and services section on our website, in addition to the toolkit on service coordination we flagged earlier. We'll put both of these in the chat. And I just encourage you all to bookmark our page, keep checking for updated resources. And in the upcoming weeks, we'll post the recording, slides, and transcripts of today's webinar on our site. Can you go ahead to the next slide? You can also sign up for the HSRC listserv at the HSRC website to receive notices about upcoming webinars, our new resources and tools, and the latest updates. And remember, we are here to help you. We are a resource center and we really want to support with any technical assistance. So if you have any questions, or want to share the work that you're doing with us so that maybe we can highlight it and learn from you, please email us at hsrc@acl.hhs.gov. I think we'll put that in the chat as well. Okay, finally, we want to thank you all for being with us here today. Especially with our weather as it continues to roll through the East Coast. I hope everyone is staying safe. We really strive to make these webinars informative and engaging, and we are always looking to improve. So we ask that you complete this short survey for us, as we always appreciate feedback. It should only take a couple of minutes and there aren't many questions. So just really appreciate you supporting us with that. And I think we'll also put this in the chat as well, the link to the survey. And next slide. Go to the next slide. And finally, I want to give a special thank you to New Additions Consulting and US Aging for all of their hard work on the development of the service coordination toolkit and today's webinar. They are both critical partners in this work for Housing and Resource Center. So thank you so much. And that is it from us. Again, thank you for starting your work week off with this webinar. Please stay in touch with us and stay safe. Thank you, everyone, and have a wonderful rest of your day.